Training Room, presented by Academy Orthopedics, expert care for elite athletes.
All right, join us for today's Training Room segment to talk a little baseball and some injuries. Dr. Casey Pierce, orthopedic surgeon with Academy Orthopedics. Good to see you, Doc. How are you?
I'm wonderful. Thanks for having me.
Thanks for making the drive in from Jersey. We're talking a little bit off air about that. Let's talk a little bit about Francisco Lindor. He's playing through a broken pinky toe. The idea of him being able to battle through that, heal that injury, and not have to spend time on the IL.
Sure, yeah. Pinky toe injuries, any fracture about the foot can be tough injuries. Obviously, they're, painful in day-to-day, whether it's just walking around or actually playing baseball on it can be brutal. When we think about foot fractures in particular, the higher the fracture, the less likely it is they can play on it. Fractures up in the higher part of the foot called the metatarsals can be almost impossible, but when you get lower in the kind of toe part, what we call the phalanxes, kind of down towards the toenail, especially the little toe, if you can brace them up or tolerate walking through them, a lot of times it's something that will heal despite walking on it or playing on it. You just got to find time in between games and practices to take it easy and give it some rest.
Yeah, now he's been in a slump since he's hurt the toe, and he won't say that that's the reason why. Is there any chance that he could be making the injury worse by continuing to play on it?
Typically not. It's more of a pain tolerance thing, especially the lower fractures, like I said. If you can tape it at the toe next to it or give it some support that way, or even something more stiff in your shoe to give you that cushion so the toe doesn't flex and extend as you push off. A lot of times it's not going to get significantly worse. It may take a little longer to feel good and heal, but long term he's going to be just fine.
All right, let's talk about Kodai Senga, grade 1 hamstring strain. Initial diagnosis, maybe a couple weeks, get reevaluated. The grade of the hamstring strain, the athlete maybe being a prototypical, a little bit of a slow healer. How long do you think Senga initially will be out?
Hamstrings are tough. The hamstring muscles are the most commonly injured muscles, and part of that has to do with the fact that they are so long and they cross two joints. They do go from above your hip to down past your knee, which makes them more prone to injury, as you see by so many athletes having hamstring injuries. In terms of the grade, that's usually dependent on the degree of muscle injury.
Okay. So
grade 1, we usually think kind of a stretch without big tears. 2 is a partial tear which doesn't rip all the way through, and 3 is where it actually separates the muscle body. In terms of recovery, I usually tell patients a week or 2 per grade. But every athlete's different, and the key for especially for a pitcher is to make sure you come back and don't re-injure it.
Okay.
The re-injury rate for hamstrings approaches almost 4 times what it would be normally if you
Wow.
don't rehab them properly, get your strength and flexibility back. Imbalances where one side is stronger than the other really increase the risk of re-injury. So it's important that he's good and healthy and balanced before he starts pushing it again.
You mentioned the importance of the rehab process. What are some of the exercises that he's probably going through?
Yeah, so initially it's a lot of stretching and things to decrease inflammation, things like scraping or cupping or anti-inflammatory medications. Once you get through that initial painful phase and you can do more, that's when you start trying to lengthen the muscle, get it back in the right biomechanic movement strategies and strength. Last phase is strengthening it and then just making sure you don't stress it too fast when you return to play. So like I said, you don't re-injure it.
All right, Doc, let's talk a little bit about Giancarlo Stanton. Oft injured. This was a strange one, though. Tennis elbow, both elbows,
Sure.
had multiple rounds of PRP injections.
Sure.
He's looked good so far since he's returned, missed 70 games. How about dealing with that, and how does the Yankees medical staff make sure there's no reoccurrence here moving forward?
I think it's a monumental job they're doing, dealing with a guy like Stanton who's had so many injuries and being smart with him. When we talk about the tendinitises around the elbow, the golfer's elbow and tennis elbow, they're not really tendinitis like the name implies.
Okay.
That implies inflammation. What they really are is disorganized healing, where the healing process of the tendon has turned from these parallel collagen fibers to almost like a jumbled ball of yarn. That's why things like anti-inflammatories and steroid shots don't really work, they just mask symptoms. Whereas things like he's getting these platelet-rich plasma injections, which kind of up the body's healing potential and turn back on the healing response, really have the best ability to get him back on the field and playing again.
How often have you ever heard of a player having tennis elbow in both elbows?
It may be a first for me. I mean, we see lots of casual people that type or work on a computer and have their wrists extended all
Right.
day, seeing
Yeah.
that. But for a professional ball player where you think about using one hand way different than the other, it's a little uncommon.
Now, Doc, I wasn't smart enough to go to medical school, right? So I got to ask you this question. How many calls do you get a day from friends and family outside of your practice looking for medical advice?
Sure. Well, I'm a California transplant, so all my friends from California, anytime a Dodger goes down, they want to know what's going on. The Yankees, I don't give too much proprietary information to my friends around town about the Yankees because I'm always kind of against them. But. But lots of them, actually. Usually, if there's a big injury you see on SportsCenter or ESPN or
Is there
or
one
anywhere,
friend in particular you know when they're calling?
It's my brother. It's 100% my brother. Every time, especially if he's got a guy in his fantasy lineup or, someone he's looking to draft, he'll ask me what the potential is for comebacks and if he should take him up.
Dr. Casey Pierce, academic orthopedic surgeon from Academy Orthopedics. Thanks so much for the time, Doc, and safe travels back to Jersey, all right?
Thank you. Appreciate it.
You got it. Great job.